21-month-old Natalie suffered a severe brain injury with traumatic effects. After surgery, she was left in complete organ failure, kidney disease creeping up, and she was a quadriplegic. The doctor said she had less than 4% chance of survival, so the family went before an ethics committee, and it was decided that end of life was the most humane thing to do. The term euthanasia originated from the Greek word for good death. It is the active practice of ending the life of a person either by lethal injection or the suspension of medical treatment. Today I'm going to inform you of the purpose and facts of human euthanasia, the history of human euthanasia, and the pros and cons of human euthanasia. Let us begin by talking about the purpose of human euthanasia. Euthanasia is defined as intentionally, knowingly, and directly acting to cause the death of another person. There are two types of human euthanasia, voluntary and involuntary. Voluntary euthanasia is when euthanasia is performed with consent. Involuntary euthanasia is euthanasia that is conducted without consent. Involuntary euthanasia happens when someone other than the patient decides to end the patient's life. Assisted suicide is intentionally, knowingly, and directly providing the means of death to another person so that the person can use the means to commit suicide. According to Medical News Today, there are two different ways this can happen: passive euthanasia and active euthanasia. Passive euthanasia is when life-sustaining treatments are withheld. For example, if a doctor prescribes increasing doses of painkillers, they can turn toxic for the patient and lead to death. Active euthanasia is when lethal substances or forces are used to end the patient's life. Active euthanasia includes life-ending actions conducted by the patient or somebody else. The purpose of human euthanasia is trying to offer compassionate options for competent, terminally ill adults who are suffering unbearably. Cancer patients are probably the most common people to use end of death for a terminal illness. It lets them have a peaceful death instead of one filled with pain and misery, and it also helps their family deal with their death by not having to see their loved one in a ton of pain. Next, let us discuss the history of human euthanasia. From 5th century BC to 1st century BC, ancient Greeks and Romans supported human euthanasia. According to the historical timeline, in ancient Greece and Rome, before the coming of Christianity, attitudes toward infanticide, active euthanasia, and suicide had tended to be tolerant. Many ancient Greeks and Romans had no cognitively defined belief in the inherent value of individual human life, and pagan physicians likely performed frequent abortions as well as both voluntary and involuntary mercy killings. In the 1930s, public support for euthanasia increased due to the Great Depression. Because of the Great Depression, popularity of human euthanasia increased greatly. People's beliefs of mercy killings of infants born permanently deformed or mentally handicapped was permissible. This belief went up 45% during this time. From 2000 to the present, many countries have declared that human euthanasia is legal, along with many of the states in the U.S. The Netherlands, Luxembourg, Belgium, and Canada all made human euthanasia legal. Within the U.S., Washington, Oregon, Vermont, and New Mexico have made human euthanasia legal, and Montana's status is being disputed. Lastly, I'm going to talk about the pros and cons of human euthanasia. Pros. When someone is in extreme pain and suffering, and they know they will die eventually, this gives them a way out without having to deal with all of the pain. Patients' families are given relief by not having to watch their loved ones suffer endlessly. The patient saves money if they are needing intensive care. If they have a terminal illness, instead of just waiting for them to die and spending ridiculous amounts of money on medical bills, they are able to end their life on their terms and not have to pay all of the money anymore. Average bills for medical treatments for terminal cases cost thousands of dollars a month. The injection needed to end someone's life costs only $40. Cons of human euthanasia. Many people believe that human euthanasia is just another form of legalized murder, that this is cutting close to the line of legal or not. For patients who are terminally ill, many doctors will argue that they are not in the right state of mind to make this decision, and they can't make the decision clearly. The drugs have messed up their head, and they aren't in the right state of mind. Eventually, if human euthanasia becomes legal everywhere, people are going to want to use euthanasia for all kinds of reasons, such as depression, old age, and illness that is not terminal. It is going to get more widely accepted, and that is not a good thing. Today we've discussed what human euthanasia is and what its purpose is, human euthanasia's history, and the pros and cons of human euthanasia. Human euthanasia has been around for centuries. People have been using this method of care since the dawn of time. Although it is a very touchy and strange topic most people would rather avoid talking about, it needs to be talked about and decided on if it should be an option or not.